Hello, everyone, and welcome to the webinar reflecting on 1 year of COVID-19. My name is Gabby Lemon, and I'm the event specialist here at Workplace Safety North. We appreciate your attendance here today and want to let you know this is our second Feed Your Brain webinar in 2021. We have a great lineup ahead, including topics on happiness and leadership, so keep your eyes peeled for those. Before we get started, we want to mention a few housekeeping items. During the webinar, you may see the screen freeze up or hear static on the microphone. This is usually temporary and due to internet connection issues. We appreciate your patience and understanding with the technology. Your microphones have been muted, and we ask that you use the Q&A at the bottom of your screen for speaker questions. If you have any technical issues using the Zoom application, do let us know in the chat box and we'll do our best to help you. So to clarify, please put any commentary or technical questions in the chat box and speaker questions in the Q&A section. Resource information and a recording of the webinar will be sent to you within 1 business day. Before I pass things over to our host for today's webinar, I would like to remind you that the 2021 Virtual Mining Health and Safety Conference is happening on April 14th, and it's free to attend. More information can be found at workplacesafetynorth.ca/events. Now I'll welcome our host, Angel Poitra, Community Engagement Specialist and Certified Psychological Health and Safety Advisor at Workplace Safety North. Welcome, Angel.
Thank you so much, Gabby. Good morning, everyone. It's a pleasure to be with you today. Before today, I went to Google and I typed in this date last year, and I want to share with you some of the things that popped up pretty quickly. Ontario closes all non-essential businesses. The House of Commons introduces emergency legislation to pass CERB. Justin Trudeau begs all Canadians in a tweet, "Enough is enough, stay home." COVID-19. Wow. A lot has happened since we launched our very first conversation last year. And it's really, really hard to believe it's only been 1 year. I keep hearing each and every day, this is more like Groundhog Day, the movie with Bill Murray. And there's one scene where Rita says to Bill, "Do you ever have deja vu?" And Phil answers her, "Didn't you just ask me that?" Sound familiar? I think it does to many of us. In the last year, I've developed and designed and delivered a few mental health sessions, COVID and Me, It's Okay Not to Be Okay. And it's given me a real window into the many, many stories of COVID and how we've all adapted, and some of us have thrived even. And I'm thrilled that the 3 guests that I'm having with me today are also going to share their stories because they all come from different walks of life. So if you've joined us for these conversations before, you know, we group it into 3 themes. And our themes today will be COVID, what was your immediate first thought? COVID, work and home. And as always, our guests are going to leave in the 3rd part and tell us their words of wisdom, things that they want to share with us that's a little nugget of learning. So we're going to put up a poll question like we do every time, because it's really nice to get a gauge as to where our audience is and how they're feeling today. So Gabby's going to put up the poll question, and it's this. So how are you feeling 1 year since the pandemic started? And there's a couple of different options. So please answer the question. And while you are, I'm going to tell you a little bit about Workplace Safety North. We're a partner in the Health and Safety System Ontario. And our headquarters are in Northern Ontario with offices in Thunder Bay, Sudbury, North Bay. We have a vision that we're very committed to, and that's that every worker is going to go home safe and healthy. And we firmly believe that safe and healthy extends to neck up. And so we're talking about mental health. So watch for some exciting developments that are going to happen in that arena in the next 6 months. We are very, very true to our natural resource roots, which is mining, pulp and paper, and forestry, but we're always happy to lend a hand to those in the north who need our help. We provide training and consulting, and we have an amazing events team, and you've met Gabby this morning and Meg, and we want to make your workplace the safest place that it can be. So Gabby, do we have the poll results? So 16% of us feel great. 47% of us have said it depends on the day. And I would tend to be in that group too. 23% of us say we're okay. 5% meh, and 9% say make it stop. So you see, we're all on the same journey, but we're feeling differently as we go through it. So today, It gives me pleasure to introduce three guests to you. Firstly, we have Karen McKissick. You remember Karen. She was our very first guest on our COVID conversations last year, and she left us with the famous words, "It's okay not to be okay." As a safety officer at the Thunder Bay Catholic School Board, Karen has a window on the impact of COVID on our school systems. Karen has her Canadian Registered Safety Professional designation, plus almost 30 years of health and safety. Yes, she did tell me she started at 12. Karen's experiences include working with government, community healthcare, and now with the Catholic School Board in Thunder Bay. Karen is a very proud dog owner who goes to work with Karen each day. And Karen wanted me to clarify, it's the dog who goes to work with her husband each day, not Karen. And Karen is still monitoring her family's toilet paper consumption and trying hard not to binge watch Netflix. She's also practicing physical distancing at various retailers, and she hopes to do more on a golf course this spring. Secondly, we have Dawn Langlois. Dawn is the area manager for workplace health and disability management at Vale in Sudbury, and he is also a certified mental health first aid trainer. And I've had the ability to sit in his class, and he's dynamite. Dawn offers a window into the world of essential workers, those who did not have a choice to work from home. He's a dynamic health leader with more than 15 years of progressive experience, and he's held senior roles within Ontario's public healthcare system, and he's led the occupational health function in a number of capacities. He's now leading Vale's workplace health and disability management portfolio. Dawn has an engaging learning style, and he brings passion and knowledge to all aspects related to occupational health. Welcome. And thirdly, but not lastly, we have Elisha Malette, a friend and a colleague of mine here at Workplace Safety North. As a fellow psychological health and safety advisor, Elisha offers a window in how the Workplace Safety North client is managing the COVID storm. Elisha also offers us a window into being a mom and working at home with her children. Elisha says that at times during COVID, her children, who are wonderfully wild, have had regular risk assessments. Elisha connects with people and workplaces to understand their health and safety needs, and she relies on her spirit-building training to make lasting connections that create impact. So welcome, Karen, Dawn, and Elisha. It's my pleasure to have you joining us today. So today, what we're hoping is that we are going to learn, we're going to reflect, we're going to laugh, and we're going to be reminded we're not in this alone. So our first thoughts are going to be around COVID and how we actually felt when the World Health Organization said this on March 11th, 2020. We have rung the alarm bell loud and clear. We have 4 areas that we're going to need to address. 1, prepare and be ready. 2, detect, protect, and treat. 3, reduce transmission. And 4, innovate and learn. So I am going to start with Karen. And Karen, how did you first feel when it was announced? Did you think this was going to be a short-term thing? Did you think it was going to be long-term? What did those words actually mean to you?
Well, actually, I started becoming suspicious that something was happening in December. So being in safety, I'm always sort of strategic and looking around and seeing sort of how to strategize and prepare. So in December, I started hearing about what was happening overseas in China, and there was this weird coronavirus thing. No one knew what it was. Everyone was talking about like it's Corona, like the beer. Which obviously it's not. So I was turning into like this storm tracker. So I started going on Johns Hopkins University website with all the dots. So you could see the dots like spreading like chickenpox all across the globe. So I was like tracking that. In January, I started to do some shopping. And yes, toilet paper, there's a formula that I have with the amount of rolls per my family members and how many I had to have. But I did not go overboard. So I was not the person that had so much to sell it on Kijiji. I just need to state that to the group here.
There were rumors, Karen.
Yeah, I'm sure, squirreling, right? But again, in February, I had a family vacation that was canceled. So again, I was a little bit ahead of where things were going. You said March the 11th, who made the announcement? I was actually angry by that time that it didn't call a pandemic sooner, because it was obvious and apparent to me that it was just attacking globally and it was coming to Canada. And by then we had our first couple cases. So at the school board here, we had meetings on Friday, March 13th. I'll never forget that day, where we called everybody into the boardroom and said, okay, we're going away for 2 weeks. Just 2 weeks, March break. Go and have fun on your March break. We're going to take a week off and we'll see you all at the end of March. Well, then we made history, because March turned into April, turned into May, turned into 2021, and we're still here. So there's a lot of thoughts at the beginning, and for me it was just, it seemed to be rolling out, but nobody was responding.
Okay, thanks for that, Karen. And Dawn, what were your first thoughts?
Yeah, thanks, Angel. And so I remember that clearly. I was actually at our Thompson, Manitoba site at the time, making my first visit to that community and our site there, and left on a Monday morning where the thought of a global pandemic being called wasn't really top of mind for me, and certainly had been, like Karen, monitoring that situation. We had spent the previous 6-8 weeks with the global health group starting to plan and prepare on how we would respond and support our workplaces across the globe, and thinking, oh, this is a lot of work and a lot of time we're doing this, and we'll probably never have to use it. And then on March 11th, I remember clearly that announcement being made, and really just the world shifting and changing from that moment on. And for me, it was just the uncertainty, right? Not only the uncertainty of when I would be able to purchase toilet paper or Lysol. I was certainly not as prepared as Karen was there, and remember my wife buying 2 rolls at a convenience store for about $11 at one point, just because we were running short. But just everything else, right? What is this going to mean for my family, my children? What is it going to mean for me, both at work and at home? And when am I going to see my Leafs play again? All of those things really started to really come to mind. And I think it was the first time, like many of us, that really uncertainty was the only thing we all had in common, right? We didn't know what was coming next. So it was the beginning of a really interesting journey where lots of learning was had, and we certainly started to roll up our sleeves from that moment on, and here we are today, a year later, not feeling some days that much different, to be perfectly honest.
Yeah, thanks for that, Dawn. Elisha, what are your thoughts when it was first announced?
So many different thoughts. Going into that week, I was training with a client and I was out of town, and while I was delivering safety training the entire week, it just sort of kept progressing. And even with that client, every conversation ended up becoming this risk management. They were food service industry. And so everything really started to focus on that. And the main theme of what we were supposed to leave with just in some ways got lost, even to the point where as training was progressing throughout the week, we could see ourselves all kind of shifting and giving a little bit more space. And, I reflect on that week as just being so intense. And traveling home from training, I had a girlfriend call and just said, did you hear that? The March break is extended and there's no school. And so I hadn't heard it yet. And I actually wasn't sure what I was going to do. I think at that point, my brain sort of moved to a bit of like a pinball machine. Everything from, oh, it'll be so great, they're going to have this extended break. Yay. Wait, what do you mean I'm going to have to now work from home with kids there? Social distancing, what the heck does that even mean? It just sort of, it kept going and going and going. I think at the end of it, it still kind of feels like a pinball machine, but maybe just moving a little bit slower some days. It's not necessarily being pinged as rapidly as it was at the very beginning.
That's a great analogy, a pinball machine. I can actually feel it going on in my head, ding, 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 and all the silver balls moving around. Maybe we should all have t-shirts made, because that is the game that we're in, a pinball game. And I do urge each and every one of you that's with us today, put your stories in the chat box. This is your opportunity to really share with us. And, we want to learn, we want to reflect, and we want to laugh, and we want to be reminded, each and every one of us is not alone, and we're all experiencing it differently, though, and our three speakers talk to that. So in our mental health training, we do an exercise and we say COVID, or we say mental health, and what's your first word that comes to mind? I'm not going to ask Elisha because she's just taken a drink of water, but I'm going to ask Karen McKissick, if I say to you COVID, what's the first thing that comes to mind?
There's so many things that come to mind with COVID, because now,
well, you can tell us more.
What it is. I think PPE. I'm going to say PPE comes to mind. Someone says a curse word. Yeah, that might have come across my mind too.
It's interesting you chose PPE, because in the health and safety world, it's probably the biggest celebration that we're having, right? That everybody in the world now knows what PPE is. It isn't just a secret for the health and safety professionals. So let's have a little celebratory, note of thanks for that everybody actually understands what PPE is. Dawn, what's your word when we say COVID?
Just resilience, and I think the need to be resilient through all this. I've seen it firsthand in my own house with 3 kids at various stages in their life. My son, who was supposed to finish his graduating year in high school with all his friends, and saying, "Don't worry, buddy, you'll get to go to university in the fall, and that'll be good." And unfortunately, I misled him there. He's been in his basement since. But and then my youngest daughters, who one started high school, the other one's 8, and just really adjusting to this, what is really not intuitive behaviors for us, right? And missing out on dance competitions and activities and friends, and so. In the workplace the same way. Just that resilience is what I'll kind of remember from this last 12 months ongoing, right?
One of our viewers must be resilient like you, because Kevin says, in the words of Corey Hart, never surrender. Thank you, Kevin, because now I'm going to have that song stuck in my head with the pinball machine. Thank you very much. Elisha, what's your word when we say COVID?
Yeah, I feel like I had 2 good ones before me, and it should have given me more time to think about it. But I would say reactive. On my end, I felt like it was just reactive each step of the way, each transition, each new announcement from, our Prime Minister, during his talks in the very beginning, to still, the language has changed to vaccine all of a sudden, and everything's around that. That's our focus. And throughout, as much as the WHO sort of said at the very beginning, prepare and be ready was the first one, there has been no proactive preparedness on my part. Everything feels incredibly reactive.
Isn't that interesting? And one of our viewers, I guess it's a kindred spirit for you, Karen. Lisa went back on her snow machine back to her cottage to get toilet paper, just in case the other world didn't have any left. So I think there's some kind of kindred relationship going on. And John is sharing, it's to be flexible. So where are some of the ways, or how are some of the ways, Dawn, Karen, or Elisha, feel free, any of you, to answer, how have you shown flexibility in this last, 12, 13 months?
Yeah, sure. I think it's been an Oh, go ahead, Karen.
No, I was just going to say a lot of day drinking and visits to the LCBO, but no, you probably have a more excellent response to this one.
Yeah, maybe not actually, but yeah, fair enough. Yeah, no, I think it's been really necessary, right? Both, again, when we talk about how the impact to our both personal and professional lives, you just had to be flexible. And I think people's ability to support that flexibility, with kids being at home and people running around and dogs barking and the fire alarm going off and having to leave a meeting just to go and see what's going on, right? I think it's just been something we've all had to do. And at times it's been, returning that favor and rolling up our sleeves and doing the work to get done. I think what's been, for me, really important is just that shared commitment of making sure everybody's safe. I haven't really experienced that to this degree. No matter where you went, people just collectively really coming together. There just seemed to be nothing more important. So
yeah. And what about you, Elisha? How have you demonstrated being flexible through all of this?
I think all boundary lines had to sort of come down. If I think about going into pre-pandemic life, I think I had pretty good boundaries between, Elisha as a worker, right? Hardworking, organized, prepared for the day, or, and at home, it would sort of be less structure, more fun, fully engaged in raising children. And then somehow throughout the pandemic, it's like the worlds had to collide, and that flexibility really had to become, it's okay if my children, I need to step away and go and deal with something, or it's okay for them to come and say hello to the screen. And it just, you had to sort of flow with everything. But the flexibility for me, and the part I really had to sort of work through, was those boundary lines have to go down, and I have to be willing to expose myself as a mom at work. And my kids on the flip side had to see me as a mom at work.
So do they finally know what you actually do? Because I know that was a big conversation at your house pre-COVID. Like, you don't really do anything. They thought you just had a friend named Angel and you really didn't do much. Has their perception of Elisha, the professional health and safety person, changed?
Yeah, I think to context that, I'm in Timmins and I don't have an office to go to. I really don't have colleagues near me. So they got to meet Angel at one point. And so Angel was the only person I ever worked with, the only one they ever asked about. Now, yeah, they're sort of like, wow, another group. Wow, who are these people? And so it's kind of endless, and they now come to camera. If they want to come and talk to me, they have to come and say hello to the group first. And so I think they're always impressed the number of faces that I get to see on a weekly basis.
Somebody said when the pandemic was first announced, I felt okay and that I could deal with it. And I would really like to know how long it's going to last. As long as it didn't last past a month or two, I thought, okay, I can handle this. Not so much now. Anybody want to talk to that? Because I saw a lot of nodding heads when I was reading it. Karen, would you like to speak to that thought?
Well, it's interesting because working in education sector, I mean, like, education is so important through our communities. And having this big beast of education pivot back and forth. I remember from March until August, we were rewriting a reopening strategy, probably 50 times to Sunday. And then we had to throw it out and rewrite it 3 days before we launched back to school. So to think of something that is so important and integral and making it move, I mean, that whole thing is just, it blows my mind on how businesses and employers have been able to navigate through this crazy torrential waterfall. It's unbelievable.
Anybody else want to talk to? I was thinking it would be okay if it didn't last too long. Dawn, Elisha, any thoughts on that?
Yeah, sure. And I think, I think it was Karen who said that at first when the kids had their extended March break, right? In 2 weeks, we'll get through this. And it's kind of almost a joke now, right? Go back and say, yeah, let's have another 2-week break. And it really has been challenging. I think I would have bet my house on saying we would be over this a year later, right? So thankfully that opportunity didn't present itself, and that I'm not a betting man. But yeah, no, absolutely. I think it's at first we were all able, for us in the home is actually, we kind of enjoyed it. We made a lot of fun board game nights and tried to make the best out of it. And then after a while, my kids stopped wanting to hang out with me, really, right? So and saying, when are you going away for work again, Dad? And I haven't been gone since. So I think they're just as ready for this to be over as we are. But we just got to continue to be patient and get through it together.
Yeah, absolutely. Elisha, anything? No, we're good.
I mean, ups and downs the whole way, Angel. I think some of those milestones, when I thought that they might not go back to school in September, I was crushed. I really didn't think that it was going to happen. And I felt like I was at the end, really didn't know how I could keep going.
Yeah. Go ahead, Don.
Yeah, I was just going to add, Karen mentions something like a school board having to adjust, and just the impact on the various employers to really have to adjust. And so when we talk about flexibility and reflect on that first answer, there was no choice but to be flexible and to adjust, and we never knew the timelines. We're currently in a lockdown here in many of our communities in Northern Ontario, and we don't know when kids will be going back to school, and that has an impact on the people we work with, the people who work alongside us, and so it's just it's amazing to see this still going on, but that ability to just get through it.
I'm watching some of the chat on the side, and what just makes me smile each and every time. Even though we're in the middle of a pandemic, you're seeing all these positive kind of notes coming from it. We're more compassionate with people and businesses. You know, we've kind of let our guard down, like Elisha was talking about with the children coming into the videos. We are all human beings. And I think there's a real common thread there that people are being a little kinder to each other. And I know in my conversation over a year ago with Karen and her friend, Amy, that was one of the things that they reminded us as we go through the next few months. That's what we thought it was. Hi, Karen. Be kind to everybody you know. And apparently we're doing really well at that. So congratulations to everyone on the call who's practicing kindness. So we're going to go into our second stream of thoughts, and that's about COVID at work and home. Because each and every one of our panelists today, just like you as our guest, has had a different window and a different lens and how you've looked at it at home and at work. So I'd like you to think, when you're going to share with our audience today, what has been the greatest change that you've seen at home? What has been the greatest thing maybe you've seen at work? So who would like to go first?
I can go. I'd like to think this is a kind of a bit of a humorous story, but you know, as we transitioned to virtual training, I knew I just wanted to jump in. And I think I felt really lucky to have a job, you know, and wanted to sort of contribute to the trending and what we could do to sort of maintain that. And when we transitioned to virtual, our employers, the WSN, had made the decision to always do 2 trainers in the same classroom, which I felt pretty lucky about and continue to, because, you know, the disruptions, the distractions at home with the kids maybe needing some support. So one particular story that always pops into my mind and was not funny at the time, but is completely funny now, is one of the days of training. I was training with a good colleague, Joanne. I'm not sure if she's on the call today, but for the 67th time that morning, my kids had asked for another snack. And this time we're sort of like parading around demanding, you know, pancakes, pancakes, pancakes. And it was Joanne's turn to be training. So I felt like, okay, you know, if I do this quickly, this would be good. So there I go in the kitchen with my laptop, whipping up a stack of pancakes and listening to Joanne, trying to support her, trying to get pancakes into my kids before it's my turn. And all of a sudden, sort of a sibling wrestling match is going on in the living room, which pulls me over there. Next, I can hear my smoke alarm cheering me on very loudly from the kitchen. Similar time frame, I can hear Joanne just saying, "Elisha, it's your turn to take over. Elisha, where are you?" And again, she was so kind. She sort of just kept going with it. But I felt like I was going to explode in that moment. And, you know, in hindsight now, I just think, okay, I didn't have to take myself off mute. I had this amazing colleague to help me out. I know my smoke detector works, which is good. And, you know, don't waste your maple syrup on pancakes that are burnt, because it's not going to feed your children. They're still going to refuse to eat it. But I think it's a good story to kind of share around just, if I could express how horrible it felt in that moment. And, you know, I don't want to say the next week I was recovered, but for sure, you know, as the months progressed, it became a funny story that I feel like I can tell, and I will kind of remember forever. So yeah.
I think I'm going to remember it forever. And the reason I'm going to remember it forever is because you have this uncanny ability to flip the coin and see the good parts of it, like your smoke detector still working. And you're right, do not waste real maple syrup on bad pancakes. I mean, those are life lessons that you're learning and sharing with all of us. So I do appreciate that. What about Karen or Dawn? What's one of the, maybe a story or a great big change at work or at home?
Yeah, for us, it was just sudden, right? Like everybody else. So I came in from Thompson on a Friday, and on Monday, everybody in who was able to work from home in our organization was asked to do so. And so I had a nice office set up previously to do some work on weekends and in evenings when I wanted to, but kind of thought it would be the nice thing to do to hand that over to my son, who was, you know, in important studies and all those types of things. And So you find yourself in these really unusual setups, sharing a home, trying to have enough bandwidth. I am in the North Atlantic Operations Center today because my kids are back at home, and they steal the bandwidth, and it's not as reliable as you'd like it to be when they're there. And so it was, you know, getting used to all that, being on a squeaky chair while you're talking and having people kind of start to just, you know, make you feel okay about it, where I was certainly one of those people. I was fairly new to Vale when the pandemic first started, and you know, was self-conscious a little bit about some of these things, right? And just how awesome it was to have people make you feel at ease. And when my daughter would come and serve me a coffee just to keep herself busy for a few minutes, how people would actually show an interest and say, "Hi, who's that?" and make her feel special, and how cool it was for her to see someone from Brazil or Indonesia, and really get to understand that technology is really an enabler. And I think we all have leveraged technology to some degree in our various organizations to minimize that geography, but I think this really forced us to do so, right? And bring each other, and how comfortable we are a year later with it, and uncomfortable. The one funny story I'll share is maybe not so specifically, but I will, you know, I should probably email the Teams application leaders to say, why do you put the mute button so close to the video button? Because there's a few times where I did put myself on video when I just wanted to share, you know, what I thought would be an intelligent comment, and maybe didn't look so intelligent in doing so. But I think we've had fun with it as an organization, and you know, created some ways to make it more comfortable for everybody too, right? The dog barking on the bingo card, etc. So it's been interesting.
Exactly. Thanks for that, Dawn. And before I go to Karen and Aster, for those of you in our audience, if you'd like to ask one of the panelists a question, just put it into the chat box, and Gabby will interrupt me and she will ask the question on your behalf, because you can see they have a lot of wisdom to share with you. So Karen, that's about a big change for you.
Well, I never FaceTimed before. So here we are, March break after surviving that, and we're having the god-awful video conferencing with the colleagues. So here I am getting ready, getting dressed, doing my hair, putting on my lipstick, putting on shoes, like the whole work outfit to go in front of my computer, to which I am now seeing my other colleagues in their natural habitats, right? So, and I noticed that we all started off so glamorous, and then within the weeks of progression, we all started to wear ball caps, we had bedhead, you know, put on the sweatshirts. And so, I mean, it was really funny for me to see the transition of people being real. And you don't get the honor and privilege of seeing that from your colleagues. So if anything, my two-dimensional colleagues now are three-dimensional, because they are allowing me into their personal life. Then that doesn't usually happen in the workplace. So to me, that was a huge gift for me to see people being real, not the work person, but the mom, the father, the caregiver, the dog lover, the cat lover, like all of that part makes people real. And to me, that was a gift. It was a gift from my colleagues. But I do truly have to say that working from home is not my fave. I do struggle with when we have our buildings and people working in the buildings as a safety professional. I need to also be in the trenches with my colleagues. So I've been fortunate to have a bit of a hybrid environment where I can come in to my office, I can go into the schools, as well as still have the ability to work from home. So that's just my little take on my colleagues and their natural habitat.
I love the way you phrase it, because now I've got pictures in my mind. And Nadine on the line is saying she's realized that she can't work at the same dining room table as her husband. And there may be a few of us who are feeling that exact same thing. It might be not a husband, it could be a partner, a child. I know that I'm living in a very small house, and there's 3 of us home all the time. And some days it's not quite as warm and cozy. And like Dawn says, you know, my daughter's like, when are you going to go back on the road? Because you're home just way too much, right? And I think some of us are starting to feel that. And there's our friend Gabby. Hi, Gabby.
Hi, Angel. Thanks. So I did receive a question for Dawn. And Dawn, I know you are very new, or you were very new about a year ago when the pandemic hit to Vale. So you may or may not be able to answer this, but the person is asking, with so little available in terms of COVID protocols, how did Vale lead the way in terms of developing protocols and policies regarding international travel and keeping everyone safe?
Yeah, I think as many organizations did at the time, there had to be some really strong decisions and strong leadership right from the onset of the pandemic. And I think I alluded to it briefly earlier on, but there was nothing more important than people's health, safety, and well-being. And as it relates to all facets regarding travel, was certainly something that required the highest level of approval, whether it was international or even domestic at the time. And really for us to define what was essential travel, right? And I think what we considered essential maybe 2 years ago is certainly not what we consider essential now. And that was for all aspects of it. And the work did start months before the pandemic was announced. And so we were fortunate to have a bit of a head start, but like everybody else, it was just really stepping into the unknown and doing what you thought was right, and then implementing things that may have been imperfect, and improving them along the way, and adjusting people's behaviors. It's, again, for our culture here in Canada, it's so different for us to not feel like we can go into the office, say hi to people, and shake their hands, and it became very, some people who maybe not have been essential to even our sites would want to go to the sites to lend support to people who were essential as an organization that was expected to continue to operate safely. Yeah. And it was pushing back and saying, every time you come to work, you're actually increasing the risk to that person who has to be there. So it was just really, again, is a lot of behaviors that we still probably have to check in on ourselves today as the pandemic starts to come into a year or more, and that fatigue sets in, is just reminding of the importance of maintaining compliance with the controls and the expectations.
And you're a testament to your organization keeping you safe. You look very safe.
Yeah, I'm one of two people here today, I think, actually. So yeah, no, and you know what, it was leadership by example. Our leaders have been, right from the onset, fully committed to this as well, right? And I think strong leadership is so important during these times, as these uncertain times have been.
And anybody that works at Workplace Safety North would say the first thing that came to mind was protecting people, and people internally and externally. And a lot of things that we never thought we could do via Zoom or Teams, now we're doing them. And Gabby, did you want to have something further?
We had another question come in that I think is relevant to all speakers. So the question is around virtual learning. So has virtual learning created many challenges, delivery of content, accessibility, or connectivity?
Oh, great question. Thanks, Maureen. Who would like to answer first? Oh, Elisha and Karen. Oh, everyone wants to answer. So we'll go for Elisha first because you unmuted first, and then we'll have Karen and Dawn talk to Maureen's question.
Like a game show.
Yes, it is. And there's prizes.
Virtual learning has been, and this is just sort of from my perspective. I mean, number one, I have this sort of interest in it because I'm no longer traveling through the long roads of Northern Ontario to get to the various places to deliver training. So in some ways, virtual has just allowed us to connect from where we are without kind of a lot of work around getting there and so on. So from that side of things, I've found it to be a bonus. Virtual learning has required us to restructure how we do things, you know, and we really have to, and while we're doing that process, it's not finished, right? We're constantly evolving it and learning from it. So it means, you know, we need to connect with the clients who are experiencing the virtual training to really figure out what's working well, what needs to be massaged out, let's say. And on the flip side, as trainers, we've really had to adjust. How do we engage with people through this screen? You still catch me wanting to use my hands, probably just at the bottom of your screen and whatnot. So we learn these strategies. And so engagement really just happens under a bit of a different lens. And I will say under virtual learning, there's this opportunity for us to connect a little bit more back to people's workplaces, where if we were in a public space delivering that training, we might not have had the same opportunity. So getting to know people from their own work environments, we're training them in their own environments, which means, you know, if we're talking about policies, procedures, it's very easy for them to reference it. The drawbacks, however, are the constant distractions that we see. People are still being able to see their emails pop up, you know, get pulled in a number of different directions. So again, that sort of takes that piece around, give yourself a break, turn your phone off, close Outlook. Easier said than done to really be able to maintain that focus. And the other big change was we can't spend 8 hours training virtually. We really do need to provide a break in between. So one of the things we have done at WSN anyways is we really look at training half days instead of full days to make sure people are having that proper break and not getting the full screen fatigue. So those are a few things I hope kind of help answer that.
Yeah, you did a great job in answering Maureen's question. Thanks, Elisha. Karen?
Well, virtual learning is twofold, obviously, because we are currently in virtual learning in our Thunder Bay school boards, and we've been extended today another 2 weeks. So I know that has a huge impact on families within our community, both pros and cons. Some people love it, some people hate it, some people love to hate it. So everything in between. And I know it's been a challenge for our staff as well to deliver the expectations around curriculum. So I know that there are ongoing struggles and challenges with virtual learning. From the employer perspective, I'm an in-person learner. That's my forte. I love delivering in-person training sessions. But I know we are limited now. So we've been kind of holding off because we've been in gray lockdown, holding off. Now I have a bottleneck for training. So hopefully next year we're going to hit the ground running with a few hybrid training situations. My goodness, it's going to be lots of fun come the fall when we can actually maybe be together and do small class learnings. So I think a lot of employers were struggling with, do I or don't I? Yes. What can I safely do? What can I not? What's the benefit? Let's put it off. So I think maybe people on this call too might be sort of in that similar boat.
Yeah, I think you're absolutely right, Karen. Thanks for sharing that perspective. And Maureen, I hope that gave you a bit of an overview from somebody in the education sector. And last but not least, Dawn.
Yeah, just echo a lot of what's already been said. You know, you look at our education sector really having to shift quickly, and I even see the improvement from when it happened on initially in the learning that my kids were supported with, and what an effort that was required to really go from a curriculum that was fully dependent on in-person learning to really support our kids and parents across Canada and probably across the world. Pretty amazing stuff. And for us, I've just been impressed with our learning and development team, who've really, again, been able to shift. In-person learning is always what's preferred and what people are used to. And yes, again, it's just another really cool example of really maximizing the capabilities of the technologies that are available to us, and making. I've been part of a few virtual learnings that genuinely they've felt like in person, right? So it's pretty cool the way people have become more comfortable with the tools, us as participants and instructors.
Yeah, absolutely. And Maureen, I'd like to just share a little story. It was a year ago, almost now, where Mike Parent, the vice president at Workplace Safety North, said, "Oh, we've canceled the in-person mining conference, the one with Drew Dudley that's coming up that Gabby talked to, and you're going to be hosting it virtually." To which I went into my home office and started to sob, not cry, but actually sob. And here we are a year later, and we're doing everything by Zoom. So I think in our minds, we thought it wasn't possible, and we were pushed into something that maybe was uncomfortable for us. And for those who work in health and safety, we're always looking for the impact, right? We want to make sure we've touched people's hearts and their brains, and we're going to see impact. And Maureen, I think the world has changed, and I think we are able to see impact, even though it's from Zoom. And Gabby, do you want to ask the other two questions that have just popped up? We can have time for that, and then we can scale back just our ending, because I think the questions are very relevant to the conversation.
For sure. So I did see a question about focusing on the facts. So someone asked, I would be interested in how you focus your employees or clients on the facts related to the pandemic rather than the myths or non-factual information. With people working virtually, how do you communicate effectively in this area?
Anybody want to tackle that?
I'd be happy
Karen?
to share.
Okay,
yeah.
Karen.
Being as that we have 1,500 employees, again, it was really important for us to make sure we gave good information, clear transparency. So that was something that we really focused on. So we set up a communication notification email. So when staff got the header from communication notification, they knew it was something important. The other thing we did is we always linked resources like the health unit or Public Health Ontario, or like resources that were the most important body that we need to go to for clarification. So we didn't want to bring in any other dynamic other than making sure that we're very clear and concise and go to the authorities on the matter at hand. So again, transparency and communication have been key. If an organization has been able to adequately communicate, they've navigated quite well through this pandemic.
Okay, great. Thanks for that, Karen. Elisha or Dawn, would you like to answer this particular question?
Yeah, sure. I would just say our commitment to our employees from the onset was that we were going to take a structured and evidence-based approach to this, right? This is a lot of unknown, and we've continued to apply that as we learn more about the virus. We hosted things like town halls with some of our clinical partners. We've engaged with public health authorities across Canada and the UK as part of my North Atlantic scope to ensure that we were aligned with our process and just with the messaging. So, and that was really important for us because we wanted to make sure our message was consistent with what people would be getting from those credible sources. And dispelling myths has been a really important piece of it, right? I think we need to appreciate that people don't see this pandemic in the same way and respect those various opinions, but remain consistent in what our approach is going to be and the expectations we have in our workplace.
Okay, great. Elisha, do you have anything to add?
I think both sort of tackled it quite well. Just because of my role, I can sort of say the way I sort of received the communication, right? I wasn't necessarily the one delivering it. And so some of the values or the valuable ways that I felt were, you know, when it was clear, the transparency, like Karen said, and regular. So it's like you sort of knew what to expect and when perhaps more information was coming. And on a client side, a lot of the guidance that we were able to provide or reinforce was basing everything around risk management, right? So what are the potential risks? What kind of controls can we put in place? And that flip between what's essential and what's not. So those were definitely some of the focus areas.
Okay, thanks for that. And just before we move on to the greatest learnings and maybe a funny story that we'll share with our guests, Lori asks, does anybody have any company policies or allowances, travel, the back to work, the mask, etc., when the vaccines are administered? So I'm thinking Lori's talking about when we go back to our offices. Does anybody have any thoughts on that? Have you started to develop company policies, or is that something that maybe you'll be working on in the summer?
Yeah, I think for us, we're embarking on a journey. And I think what we've learned in these last 12 months is that what the office looked like before may not be what it looks like as we move forward. And so we continue to engage stakeholders at all levels and within our organization to just really ensure that what we do there is meets the needs of both the organization and the people who work for it.
Okay, great. Karen?
And I guess my comment would be is I don't really believe that in September in our new school year, it's going to look much different than where we are now until we start getting vaccinations for our children under the age of 17. So until we start making some more progress, I can't imagine the physical distancing, the PPE, the hand washing, all of our same strategies that have been very effective in making sure that our schools are safe places will still be. Our staff will probably be vaccinated, fingers crossed, the vaccines keep flowing. But again, I think that the way to the new normal will take a little bit of time to start shedding some of those barriers right now.
So Dawn and Karen, to answer the second part of Lori's question, because you've both had people still working throughout at different times, are you providing them with the masks that they need and the shields or any PPE that they would need? Is the organization paying for that? I think that's one part of Lori's question.
Yeah, okay, sure. In that sense, yeah, we've offered PPE and everything that our employees need to be kept safe throughout this. We've invested in things and partnered with other community organizations to even have access to testing. And so many, as it related to keeping our employees, our communities, and our workforce and workplaces safe, it was never a question. It was just, let's do what's right.
Okay.
And
Karen's nodding.
Too,
okay.
Yeah, the Ministry of Education has worked with Public Health to make sure that we have PPE. Now, we started off with not the best PPE, I'll be honest with you, but now they started to source us with something that, because our group has never worn PPE I mean, they're wearing it 8 hours a day. I mean, it is a long haul when you're wearing a mask and very uncomfortable face shields or safety glasses. So we're making some headway.
Granted, it is. And as somebody who's got a hearing impairment, you add the mask, it's just a really wonderful world to be living in. So I'm going to take the high road, just like our participants and our guests. So we're nearing the end of our time together, and I really want to ensure that we hear from our guests. And we do have a video, and I'm going to probably surprise our producer and our guest by now by saying we're not going to show the video. We're going to send you the link in your resources after to the participants, because we think it's really important. But I wanted to make sure we listen to our participants and answer their questions, because this is what the Feed Your Brain series is all about. So we're going to send you the link to the video. You know, spend 2 minutes for yourself and watch it, because it really reflects on a lot of the things that we've talked about today. So as every COVID conversation, it ends with the wisdom and potentially the laughter of our panelists. So I would like to start with Karen McKissick, and I want you to share with us, if you can, Karen, your greatest learning. And I learned a lot from you a year ago about being kind, and it's okay not to be okay. And I know you, and you've probably developed some other nuggets of learning that you can share with our group today. So I'm going to ask you to share first, Karen.
Sure, I have a few learnings. Actually, this was a good reflection for me being part of this panel today. So again, I wanted to send my appreciation to being asked to come back. So I guess I totally didn't bomb the first time around for round 2. So hopefully we won't have a round 3 in 2022. We might be somewhat back to a new normal. But I guess I have 3 learnings. So the first one is I can make a difference. Even if it's a small difference, like washing my hands or wearing my mask, these are all the things that I can do for the greater good of all mankind. So again, it's breaking it down into small little nuggets. I don't have to panic shop. The supply chain is good. Again, I love my local businesses. I love my grocery clerks, my paramedics, my EMS, my frontline healthcare workers, my long-term care PSWs, my staff and colleagues in education that are making some incredible creative outcomes and successes. I miss hugging my mom. I miss hanging around with my friends, but I know if I do that in the short term, it's going to be worth it once we get to that safe place to be. The second part of my greatest learnings is what I'm calling the COVID cracks. I think we had cracks in our system before that COVID has exposed. So if you're working in an employer that had poor leadership, COVID only amplified that. If you were looking at provincial or federal or municipal government, if there was poor leadership, it magnified. So again, it really is something that I think back, our PPE stockpile. Why did we not have a PPE stockpile for the pandemic? Why did we get rid of that? Why is long-term care homes so dramatically affected by COVID? Why were so many deaths in long-term care? So these are all questions that I have as system-wide, that even though I'm just one person, I'm responsible to keep pushing those questions forward to resolve them, because it's not okay that this was happening to our seniors. Again, relationships between public health and employers have never been so important. We're Ministry of Ed. Yeah, public health would come in, public health nurses would come in, but now we're working in tandem out of our silo. So it's creating new repertoire and relationships between some different work groups that we've never had the opportunity or pleasure to work with. And that in itself is a gift. So I'm really curious to see on how that's going to unfold in the future. But my third point and my greatest learning is this too shall pass. It might pass like a kidney stone, but it's going to pass. And we need to come away with some lessons. The first one for me is gratitude. Every day I wake up and I thank the powers that be that I'm healthy, I have food in my cupboards, I have a healthy family, I have a job to go to, because I know a lot of people are really struggling right now with all of those things. So again, it's gratitude. It's resilience. Human beings are resilient. We're strong, we're creative, we come back when times are tough and challenging. The other thing is too, is I have a new appreciation for mental health. And Angel, you mentioned at the beginning that you've done some mental health sessions. All of us in our own way have been impacted with our mental health. We are strong creatures, but again, there's days where I am not okay. And in reflection, it's like, it's okay that we're not okay. But when someone else that I know is really struggling, even in my workplace or my personal life, I'm going to be more responding, more supportive of that. So I think that whole journey for me has really opened up my eyes to struggles that people are going through. When we have a new normal, I think we're going to be able to do all those things we love to do. We're going to hug family. We're going to travel to places near and far. We're going to redefine how we work. We are going to have a hybrid work life. We are going to see people as more than just two-dimensional colleagues. Again, there's going to be so many gifts. I know in the education sector, there's a lot of gifts that we're going to have bringing forward as we share with our students and our staff on ways that we actually can educate. But finally, I have created a dictionary of words I will never use again post-pandemic, and I'm going to share them with this group very quickly. Unprecedented, never will use that word again. Pivot, fluid, planking the curve, what the heck was that one? Super spreader, and I will never ever say speaking moistly in my life, this pandemic. So those are my thoughts and my greatest learnings.
Thank you, Karen. You made, I don't know, but you made those words just sound so dirty. And Dawn, on to you.
Yeah, thanks. Great stuff, Karen. For me, I kind of broke it down, Angel, in two sections. So from a professional perspective, what I'll take away is really the appreciation of what we're capable of when we're pushed to this. If someone would have told me a month or two before the pandemic that you're going to be, your organization's going to be faced with this challenge and you're going to get through this in a way that was good, I would never have believed it. And it was just amazing for me to see the amount of people willing to step up at all levels and just wanting to pitch in to do their part. It was just incredible for me. I've been with Vale for 16 months. So when this pandemic started, just 3.5 months into my journey with Vale. So for me, it just accelerated my internal network there and just got to learn from so many amazing people. Really will be fortunate. It'll have a life lasting impression on me. And just the reminder of checking in on people's mental health. So I know from a professional perspective, from again, the top of our leadership, I've had, the top of my organization ask me, how are you doing? And it was like, geez, I haven't asked myself that enough. And sometimes when we're not having people on video, it's reminding them, let's plan for a video, not pushing them to put it on video that moment, but planning some video chats so you could check in on your people, right? And have those conversations and make sure people are doing okay. We do it intuitively when we're in the office and having those coffees, but we don't intentionally check in on one another as much through this virtual world. So I think there's just an opportunity for us to do that more consciously moving forward. From a personal perspective, for me, it's never taking granted of the moments, right? So I talked about my son, who's my oldest. He was going to be the first person I see walk on a stage and grab that cap. And he had worked so hard in high school, and I've been looking forward to that moment. And so was I. And it just never came, right? And I think we feel this sense of entitlement for these things to happen, right? So weddings that we missed, I celebrated my 40th birthday and it was with my family. And so, in isolation, which is fine, but it's, my daughter's dance competitions, all these things that, they just happened and I took it, I surely enjoyed them, but I don't know that I really appreciated the moment as much as I did. So
absolutely.
Yeah,
and I don't want to cut you off, Dawn, but I'm going to have to, because we've got to give Elisha her greatest moment of fame and sharing her best learning, because we try to keep it on time because we respect everybody's time. So Dawn, I could listen to you for days, and I just want to say goodbye to each and every one of you. I want to thank you for joining us, and Elisha, you will end our COVID conversation 1 year later. So there you go, my friend.
I will do my best to be quick. So I think my clear focus lesson that I'm going to take away is the concept of communicate. I've really learned the importance of, to the kids' teachers, I'm really sorry they're not going to get their work done this week. To, my kids, I can't do this without you. I need you to step up and help with, these specific tasks. To my manager, who may or may not be on the call right now, I'm sorry I can't meet this deadline, or I maybe need to set some priorities and sit down with him. My husband, sorry, you are going to have to go to work late today, or I need you to take this day off because it's non-negotiable on my side. And then the sort of last person that's maybe the hardest to communicate would be with myself. So giving myself that privilege to say, okay, Elisha, it's okay. You may not be able to do this today, or you may not do it to the standard you want to, but you're going to get it done. And my quick reflection, Angel, because I've heard you say it a number of times, is all about the boat. We're all going through a pandemic together, but we're all on different boats. And the reflection, like Karen said, being asked to do this has you reflecting. And all I could think of was I was grateful to have a bailing bucket in my, my boat full of holes. I was happy not to be on a cruise ship. That was definitely there. And, at the end of it, I think I finished in a well-dented, well-used canoe, sometimes having to paddle like heck to just move that inch. And then other times sort of having that wind at my back to push me along. And so thank you for giving me that final word. And yeah, thank you for the opportunity.
Thank you, Elisha. Everyone keep paddling. Stay safe.